Today we're going to talk about something incredibly important, something that could save your life or the life of a woman you love. We're talking about strokes. Now I know what you might be thinking, strokes happen to older men, right? But the reality is, strokes are a major health threat for women, and tragically the signs are often missed. Women don't always experience the classic dramatic symptoms we see in movies. Instead, the signs can be subtle, quiet, and easily dismissed as just feeling off or tired. These subtle signs are what I call the silent signs of stroke, and they are anything but harmless. They are urgent warnings from your body that your brain is in crisis. Recognizing them for what they are is the single most important step you can take toward getting the immediate medical help that is crucial for survival and recovery. Ignoring them, or writing them off as something else, can have devastating consequences. We're going to pull back the curtain on these sneaky symptoms that too many women overlook. In this video, we're going to walk through 7 of these silent stroke signs that are particularly common in women. My goal is to arm you with knowledge, to empower you to listen to your body, and to act without hesitation. This isn't about creating fear, it's about creating awareness. Because when it comes to a stroke, every single second counts. Understanding these signs is not just a health tip, it's a lifeline. So let's get started and learn how to protect ourselves and the women in our lives. The first silent sign we need to talk about is sudden confusion. This isn't just a moment of forgetfulness like misplacing your keys. This is a profound and abrupt change in your mental state. One minute you're going about your day, clear-headed and focused, and the next you feel like you're in a fog. You might suddenly find yourself unable to understand what someone is saying to you, even if the words are simple. It's a terrifying feeling of being lost in your own mind. This type of confusion can be easily dismissed. You might think, oh, I'm just tired, or maybe my blood sugar is low. A woman might blame it on hormonal changes, stress from work, or not getting enough sleep the night before. It's so easy to rationalize this symptom away, because it doesn't seem overtly physical, like a crushing chest pain. But this is a critical mistake. This mental fog is a direct signal that the blood supply to the parts of your brain responsible for thought and comprehension is being compromised. Imagine trying to have a conversation and the words just aren't making sense, or you're trying to complete a simple task, like making a cup of tea, and you suddenly can't remember the steps. This isn't a gradual decline, it's a switch being flipped. This sudden inability to process information or understand your surroundings is a neurological emergency. It's your brain's cry for help, indicating that brain cells are being starved of oxygen right at that moment. When a stroke is occurring, a clot or a bleed is interrupting blood flow. The brain is an incredibly sensitive organ, and any disruption can cause immediate and noticeable functional changes. The areas of the brain that manage language, executive function, and awareness are particularly vulnerable. So this sudden confusion is a direct manifestation of that underlying crisis. It's not a psychological issue, it's a physiological one of the highest urgency. So what does this look like in real life? It could be a woman who suddenly stops mid-sentence, looking bewildered. Or she might start responding to questions with nonsensical answers. She might appear disoriented, not knowing where she is or what time of day it is. It's crucial for her, and for those around her, to recognize this isn't just a moment of being flustered. It's a 5-alarm fire in the brain. This symptom is often paired with what we call aphasia, which is difficulty with language, and we'll touch on that more later. But the key takeaway here is the word sudden. If you or a woman you know experiences a sudden, unexplainable bout of confusion or trouble understanding, you cannot afford to wait and see if it passes. This is a potential stroke in progress. Never, ever dismiss this sign. It's not just stress. It's not just fatigue. It is one of the most important and most overlooked signs that your brain is in serious trouble. Recognizing it for the emergency it is can make all the difference in the outcome, preserving brain function, and, ultimately, saving a life. Pay attention to that sudden mental shift. It's a life or death clue. Now, let's move on to our second sign, and this one might feel a little more familiar, but with a twist. It's sudden numbness or weakness, particularly when it's on one side of the body. We've all had a foot fall asleep, that pins and needles sensation. This is not that. This is a sudden, often dramatic loss of feeling or strength in your face, arm, or leg. One side of your body suddenly feels different, heavy, or unresponsive. Think about it this way. Your brain is divided into 2 hemispheres, and each hemisphere controls the opposite side of your body. The right side of your brain controls the left side of your body, and the left side of your brain controls the right. When a stroke occurs, it typically happens in one specific area of the brain, affecting one hemisphere. This is why the symptoms so often manifest on only one side of the body. It's a telltale sign of a central nervous system problem. This weakness can be subtle, or it can be profound. It might be a slight drooping on one side of a woman's face. You might ask her to smile, and you'll notice one side doesn't lift as much as the other, or it could be a sudden weakness in her arm. A simple test is to ask her to raise both arms straight out in front of her. If one arm starts to drift downward, that's a major red flag. She might not even notice it herself until she tries to do something. Imagine you're holding a coffee mug, and all of a sudden, your fingers lose their grip and the mug crashes to the floor. Or you're walking, and one leg just seems to drag, refusing to cooperate. This isn't muscle soreness from a workout. This is a neurological deficit. The signal from your brain to that limb is being blocked or scrambled. It's a direct indication that the motor cortex in your brain is under attack. For women, this symptom can be especially confusing. We're often conditioned to push through discomfort. A woman might feel her arm go weak and think she just slept on it funny or pinched a nerve. She might feel a numbness in her leg and decide to just walk it off. This tendency to downplay physical symptoms, to not want to be a bother, is incredibly dangerous when it comes to stroke. The key here again is the sudden onset and the one-sided nature of the symptom. It's not a generalized feeling of weakness all over, it's localized to one side. It could be the entire side of the body, or it could just be the face, just the arm, or just the leg. The pattern doesn't matter as much as the fact that it's happening suddenly and asymmetrically. This is your body's way of drawing a map to where the problem is in your brain. So please, if you feel this, or see it in someone else, don't wait. Don't say, let's see how it feels in an hour. An hour is a lifetime when brain cells are dying. Perform the F.A.S.T test. Face drooping, arm weakness, speech difficulty, time to call 911. That arm drift is a classic sign. This sudden, one-sided numbness or weakness is an undeniable medical emergency. The third silent sign of a stroke in women is sudden trouble with vision. This is another symptom that's incredibly easy to misinterpret. Our eyes can play tricks on us for all sorts of reasons: fatigue, migraines, or even just needing a new glasses prescription. But when vision changes happen abruptly, without any warning, you have to consider the possibility that the problem isn't in your eyes, but in your brain. This vision trouble can manifest in several different ways. It could be a sudden blurring of vision, or your vision might become dim, as if someone turned down the lights. For some, it's double vision, where you suddenly see two of everything. For others, it can be a partial or complete loss of vision in one or both eyes. It might feel like a curtain is being drawn over your field of view. Any of these sudden changes are cause for immediate concern. The reason this happens is that a significant portion of your brain, the occipital lobe located at the back, is dedicated entirely to processing visual information. Your eyes are just the cameras. Your brain is the computer that turns the signals into the images you see. A stroke can disrupt the blood flow to this visual processing center, or it can damage the nerve pathways that connect the eyes to the brain. When that happens, your vision is one of the first things to be affected. It's really important not to procrastinate a visit to the eye doctor. Think about what this would feel like. You're reading a book, and suddenly the words on the page are blurry or doubled, or you're driving, and you realize you can't see out of the left side of your visual field in both eyes. This isn't a gradual change over months, it's a change that happens in seconds or minutes. You might be tempted to just rub your eyes, or use some eye drops, and hope it goes away. This is a dangerous gamble. This symptom is particularly frightening because our sight is so fundamental to how we navigate the world. A sudden loss of it can be disorienting and terrifying. It's also one of the painless symptoms, which can make it seem less urgent to some people. But remember, a stroke itself often doesn't cause pain in the traditional sense. The damage it does is silent, which is why we must be vigilant about these functional signs. If you suddenly experience blurry vision, double vision, or a loss of vision in one or both eyes, don't assume it's just your eyes. Consider the whole picture. Are you also feeling a little dizzy, a little weak on one side? Even if the vision change is the only symptom, it is more than enough to warrant an emergency medical evaluation. The visual system is a delicate and complex network, and a sudden disruption is a major red flag. Don't book an appointment with your optometrist for next week. Don't wait to see if it clears up on its own. Sudden, unexplained vision trouble is a potential sign that a part of your brain is suffocating. It's a neurological event, not just an optical one. Treat it with the urgency it deserves and get to an emergency room immediately. It could be the decision that saves your sight and your life. Our fourth sign is one that many women experience from time to time, which makes it especially tricky: sudden dizziness or a loss of balance. We've all felt a little lightheaded if we stand up too quickly, but the dizziness associated with a stroke is different. It's often a severe, world-spinning vertigo or a sudden, unexplained problem with your coordination. It feels like the ground is unstable beneath your feet. This symptom is linked to a part of your brain called the cerebellum, which is located at the back of your head, beneath the main cerebrum. The cerebellum is your body's coordination center. It controls your balance, your posture, and the smooth execution of all your movements. When a stroke affects the cerebellum or the brainstem it's connected to, these fundamental abilities are thrown into chaos. So what does this feel like? It's not just feeling a bit woozy. It might be a sudden, violent spinning sensation that makes you feel nauseous. Or, you might suddenly find yourself unable to walk in a straight line. You might be stumbling, veering to one side, or feeling like you're about to fall over with every step. People might describe it as feeling drunk when they haven't had a single drop of alcohol. It's a profound loss of control over your own body. Because dizziness can be caused by so many other things: an inner ear issue, dehydration, low blood pressure. It's very easy to dismiss. A woman might think she's just having a vertigo attack or that she's tired. She might sit down for a few minutes, hoping the feeling will pass. But if the dizziness is sudden and severe, and especially if it's accompanied by any of the other signs we're discussing, it must be treated as a potential stroke. A simple test you can do if you're feeling this way is to try to walk heel to toe, like you're walking on a tightrope. If you're suddenly unable to do this, your coordination is significantly impaired. Another sign is a sudden lack of coordination in your hands. You might find yourself unable to pick up an object, or your movements might become clumsy and jerky. This is what doctors call ataxia. The danger with this symptom is not just the stroke itself, but the risk of falling and causing serious injury. A sudden loss of balance can lead to a fall that results in a broken hip or a head injury, compounding the medical emergency. That's why it's so important to recognize this sign for what it is, and to sit or lie down immediately and call for help. So, if you or a woman you love suddenly feels intensely dizzy, if the room starts spinning, or if they suddenly can't walk straight, do not ignore it. Don't chalk it up to being tired or dehydrated. Think brain. Think cerebellum. Think stroke. This sudden breakdown in your body's GPS and coordination system is a classic, though often overlooked sign of a neurological crisis. The fifth sign is one of the most alarming: a sudden, severe headache with no known cause. I'm not talking about your typical tension headache or even a standard migraine that you might be familiar with. This is different. Many stroke survivors describe it as the worst headache of their life. It comes on like a thunderclap, reaching its maximum intensity within seconds or minutes. This type of headache is a hallmark of a specific type of stroke called a hemorrhagic stroke, which is caused by a ruptured blood vessel in the brain. When an artery bursts, blood spills into the surrounding brain tissue, causing a rapid increase in pressure inside the skull. This pressure is what causes the explosive, excruciating pain. It's an unmistakable, agonizing sensation. Unlike a migraine, which might be preceded by an aura and build up over time, a thunderclap headache is instantaneous and overwhelming. You could be perfectly fine one moment, and the next, you're hit with a level of pain you have never experienced before. It might be accompanied by a stiff neck, nausea, vomiting, and sensitivity to light, which can sometimes cause it to be mistaken for a severe migraine or meningitis. However, the key distinguishing factor is the speed of onset. It's the suddenness and the severity that scream emergency. You won't be wondering if you should take some aspirin. You will know, instinctively, that something is terribly wrong. This isn't a symptom to wait out. It's a sign that your brain is actively bleeding, an event that is life-threatening and requires immediate neurosurgical intervention. It's important to note that, while this is a classic sign of a hemorrhagic stroke, not all strokes cause headaches. In fact, the most common type of stroke, an ischemic stroke, caused by a clot, often does not involve a headache at all. This is why it's so crucial to know all the signs, not just this one. But if this particular sign does occur, its importance cannot be overstated. For women who suffer from chronic migraines, it can be tempting to mistake this for just a particularly bad episode. But you know your body. If a headache feels dramatically different from your usual pattern, if the pain is more severe, if the onset is more abrupt, you must err on the side of caution. Don't just go lie down in a dark room and hope it gets better. This is not a symptom to self-diagnose. A sudden explosive headache is one of the most urgent medical emergencies you can experience. It's a 5-alarm fire. If this happens to you or someone you're with, call 911 immediately. Tell the dispatcher you suspect a stroke and describe the headache as sudden and the worst ever. This specific language will alert them to the extreme urgency of the situation. Our sixth sign is another communication-related issue, sudden trouble speaking. This is different from the confusion we talked about earlier. This is about the mechanics of speech itself. You know what you want to say, the thoughts are clear in your head, but you can't get the words out. Or, when you do speak, the words come out jumbled, slurred, or completely wrong. This condition is medically known as aphasia, or dysarthria. Aphasia is a problem with the language centers of the brain, affecting your ability to find the right words and form coherent sentences. Dysarthria is a problem with the muscles you use to speak, causing slurred or slow speech. Both can be caused by a stroke that damages the specific parts of the brain responsible for these functions, most often in the left hemisphere. Imagine trying to ask for help, but all that comes out is gibberish, or trying to say your name and your speech is so slurred that no one can understand you. It's an incredibly frustrating and frightening experience. You are effectively trapped inside your own mind, unable to communicate your distress. This is a classic and very specific sign of a stroke. For the people around a woman experiencing this, it can be very obvious. If you're having a conversation and she suddenly starts speaking nonsense or her speech becomes unintelligible, that is a massive red flag. A simple test is to ask her to repeat a simple phrase, like "the sky is blue." If she can't repeat it correctly, if she struggles with the words or slurs them, you need to act immediately. This is the S in the F.A.S.T acronym for stroke recognition. Speech difficulty. Like facial drooping and arm weakness, it's a primary indicator of a neurological event. It's not something that can be easily explained away. You don't just suddenly start slurring your words for no reason, unless there's a serious medical issue or intoxication is involved. In a sober person, it's a sign of a brain attack. Again, the key word is sudden. It's not a lifelong speech impediment. It's a change that happens in an instant. 1 minute. One day, she's speaking normally, the next, she's struggling. This rapid deterioration of speech ability is a direct consequence of brain cells being deprived of oxygen and starting to die. The language and speech centers are highly specialized, and they're very sensitive to any interruption in blood flow. Don't mistake this for confusion or being overly tired. Don't laugh it off or get frustrated. Recognize it for the emergency it is. If you see this sign, it's time to stop everything and call for help. This is not a moment for hesitation. This is a clear, unambiguous signal from the brain that it is in crisis and needs medical intervention right now. Finally, we come to our seventh sign, and it might be the most silent and most easily dismissed of all, especially by women's sudden, extreme fatigue. This isn't your normal, end-of-a-long-day tiredness. This is a profound, crushing, and sudden wave of exhaustion that comes out of nowhere. It's a bone-deep weariness that makes you feel like you cannot move, like all the energy has been drained from your body in an instant. Women, in particular, are conditioned to push through fatigue. As mothers, partners, caregivers, and professionals, feeling tired is often just the baseline state of existence. So, when this overwhelming exhaustion hits, the first instinct is to rationalize it. I didn't sleep well. I'm just run down, I need more coffee. The thought that it could be a sign of a stroke might not even cross their minds. But this type of fatigue is different. It's a neurological symptom. When your brain is under attack from a stroke, it's a massive physiological crisis. Your body may respond by initiating an overwhelming shutdown response. This sudden, incapacitating tiredness can be a primary symptom of a stroke, especially for strokes occurring in the brainstem, which regulates consciousness and alertness. This sign is often reported by women who have survived strokes. In retrospect, they recall a sudden, inexplicable need to lie down. an exhaustion so complete that they couldn't even lift their head. It's more than sleepiness, it's a total depletion of energy. It can be the very first sign, or it can accompany other subtle symptoms like dizziness or general weakness. Because it's such a non-specific symptom, it's crucial to look at the context. Did this fatigue come on abruptly? Is it completely out of proportion to your activity level? Are you a normally energetic person who suddenly can't keep your eyes open? If the answer is yes, and especially if you feel any other unusual symptoms, no matter how subtle, you must consider the possibility of a stroke. This is a dangerous sign precisely because it's so easy to ignore. The impulse is to just go to bed and sleep it off. But if it is a stroke, sleeping it off is the worst thing you can do. You are losing precious time during which medical intervention could save brain tissue. The treatment window for stroke is incredibly short, and every minute wasted is a minute that brain cells are dying. So, I'm speaking directly to all the women watching this. Please, learn to listen to your bodies in a new way. If you experience a wave of fatigue so profound that it feels like a lead blanket has been thrown over you, stop and think. Is this normal tiredness, or is this something different? Is it sudden? Is it extreme? Don't be a hero. Don't just push through. Your life could depend on you taking that sudden crushing fatigue seriously. We've covered a lot of ground today, from sudden confusion to overwhelming fatigue. These 7 signs, confusion, one-sided weakness, vision trouble, dizziness, severe headache, speech difficulty, and sudden fatigue, are the quiet warnings that a woman's brain is in crisis. They are so often ignored, chalked up to stress or just having an off day. But as we've learned, they are urgent signals that require immediate action. My hope is that by arming you with this knowledge, you will never dismiss these signs in yourself or in a woman you care about again. If you recognize any of these symptoms, the time for guessing is over. The time for waiting is over. You must act immediately. Call 911 or your local emergency number right away. Do not drive yourself to the hospital. An ambulance can begin life-saving assessment and treatment on the way, and they can alert the hospital to prepare for a stroke patient, saving critical minutes. Remember the acronym F.A.S.T. Face drooping, arm weakness, speech difficulty. Time to call for help. Your brain cells are dying with every second that passes, and early treatment is the key to a better outcome. Please, share this video. Talk about these signs with your mother, your sister, your daughter, your friends, and your colleagues. Building awareness is our most powerful weapon against the devastating impact of stroke in women. Early detection and rapid treatment can mean the difference between a full recovery and lifelong disability, or even life and death. Listen to your body, trust your instincts, and never, ever be afraid to make the call. It's the most important call you could ever make. Thank you for watching.